So today we're going to be going over concussion pathophysiology for the audience of a team's physician. Three key points I want to get across. A concussion is due to a traumatic or direct force transmitted to the brain, causing a shaking of the brain. And due to the shaking of the brain, we have two types of injuries. We have coup and counter-coup. Coup is when we have an injury to this that is on the same side that the force is applied on. And then counter-coup is when the injury is on the opposite side of the force that is applied. We call that the rebounding effect. Neurometabolic cascade is when the cell is using more energy than they actually have. We'll be getting into more details of that on the slides to come. So the normal function of a cell, the neuron, the brain cell, we receive the message from the dendrites of the cell, of the neuron. It is then processed in the body of the cell and then sends a message, transmits it through the axon into the terminals where the synapse happens, and the transmitters are then released to the other cell for communication. This is how a cell normally functions. Now we take place into the neurometabolic cascade and how this plays a role within the whole function of a neuron. So with the stretched out and injured neuron, we have a decrease in potassium. Potassium leaks out of the stretched cell, which then increases calcium into the cell. This also increases the demand of energy, glycolysis, and we have a decrease in cerebral blood flow. As we see here on the chart, this is all the spikes and how each of the ions return back to normal over a period of time. So as we see, we have calcium increasing within the cell, we have cerebral blood flow decreasing, we have glucose spiking, and we have potassium spiking as well. And then also decreasing. But over a course of 6 days, they all should resolve back to baseline. For concussion signs and symptoms, we have three categories that we can throw them into. We have somatic, cognitive, and neurobehavioral. So somatic is a list of headaches, dizziness, sensitivity to light, balance issues, nausea, vomiting, ocular motor, and vision problems. Cognitive is more confusion, foggy feeling, amnesia, delayed verbal and motor responses, and loss of consciousness. Neural behavior is fatigue, drowsiness, sleeping more or less, irritability, anxiety, sadness, and overall more emotional. We then have an athlete for recovery. We put them through a return to play protocol. We cannot start this protocol unless the patient is asymptomatic. We start with no activity, and then we lead into light aerobic exercises. We go into sport-specific exercises, non-contact training drills, full contact practice, and then we are finally return to play. We cannot jump from one progression to the next within 24 hours. We have to have asymptomatic, we have to have an asymptomatic patient throughout each stage. If we start developing symptoms within one stage, we stay at that stage or we digress back and we go from there. That is all for today on concussion pathophysiology. Thank you for watching.